Good day, fellow learners. This is your mentor, your fact check buddy, Gapuz, bringing you once again my favorite memorization and mastery strategy, PECHA KUCHA. And we're now on PECHA KUCHA number 5. But before we get to start our PECHA KUCHA, let me first share with you what a PECHA KUCHA is. It is actually a storytelling format that utilizes 20 slides, with each slide being commented on for a maximum of 20 seconds. Therefore, the method could usually last for 6 minutes and 40 seconds. And if you repeatedly listen to it, eventually you will be able to master the key points that I want to highlight for you to remember as you prepare for your NCLEX RN. But before we get to start, I'd like to ask you to join us in this mission. Our goal is actually to help nurses by providing free NCLEX RN application and review to 100 nurses this year. We've done it for a couple of years already, and we want to do it again this time. So to help us achieve this, please just watch and finish the ads in our videos. That's all I ask of you. That's all I ask of you. Okay? So thank you very much for your patience and kind indulgence. Okay, here we go. Ready? And 3, 2, 1. The first of the things that we need to remember for PECHA KUCHA number 5 would be kosher diet. Please note that this is indicated for Jewish patients, and the only kosher bread would be the unleavened bread. Always remember that. So which simply means this bread contain no yeast. So they're not processed with the yeast. Example would be matzo. Now, turkey in itself is kosher. Cheese in itself is kosher. However, when you combine the two, then this becomes non-kosher. Halal food, on the other hand, is indicated for Muslim patients. Halal means foods that are allowed. So you have to avoid your PSS, pork, shellfish, scallops. And pay particular attention to this thing. Strepsils are considered as halal. Gelatin is not halal. And of course, the next one would be the diet for a patient taking lithium. Pay particular attention that in order for lithium to be excreted from the body, you need high sodium, high fluids diet. For MAO inhibitors, instruct the patient to avoid eating foods with preservatives because they contain tyramine. So avoid overripe ABC, avocado, banana, and cheese. However, cottage cheese and cream cheese are allowed. So raisins and prunes should also be avoided. For patients with cystic fibrosis, the diet should be high fat, high calorie, and high sodium. High fat because you have to replace the fats that they are unable to digest. Therefore, the patients could eat fruits, vegetables, dairy products, including milk, but avoid artificial sugars. Next, for patients with celiac disease, remember, gluten-free diet. And I'd like to highlight licorice. Licorice root is gluten-free. However, licorice that is processed, specifically if it's used for the treatment of sore throat and as an aphrodisiac, is not considered as gluten-free. So licorice root is the one that's gluten-free. Diet for a patient with COPD should be high in calorie and high protein. So bread, fruit, and vegetables are high in calorie, and milk, eggs, and cheese would be high in protein. And these are the foods that are appropriate for your patients with COPD. Next, diet for diverticulosis. Remember, diverticulosis, there's no inflammation yet, so it's going to be high fiber. Vegetables are allowed, including your 4Bs, meaning brown rice, beans, bananas, and broccoli. There are no more restrictions in terms of nuts and seeds and popcorn, though those are already restricted in the past, but no longer restricted now in the present. So for diverticulitis, once inflammation has set in, remember the diet should now be low fiber. So instruct the client to avoid fruits with skin and vegetables. Specifically, that includes your onions and of course your garlic. So which are allowed would be canned fruits and vegetables and fish. Now, for patients with dysphagia, always remember that it's more difficult for them to swallow foods that are in liquid form. So in essence, you have to provide them pudding or mashed banana, and these are usually indicated for stroke patients and patients with Parkinson's disease. you have to refer them to speech-language pathologist. Iron deficiency anemia, the risk is increased if the patient has excessive intake of milk, which means for infants, excessive means more than 1 liter or more of milk. So the normal amount of milk intake should be 400 to 800 ml per day. Next, folic acid deficiency could lead to neural tube defects. So instruct adult patients to have 400 micrograms of folic acid per day, and for pregnant patients to have 600 micrograms of folic acid per day. Common sources would be the 3Bs, broccoli, beans, and beef. And of course, your dark green leafy vegetables like lettuce, peanuts, and turnips. For patients with pancreatitis, the diet should be low fat. So you have to provide small frequent meals, meaning 4 to 6 small feedings, lean meat, low fat milk, and they're allowed to eat rice, pasta, and crackers. Next, for patients with Pheochromocytoma, the main symptom here is hypertension. So the diet, instruct the client to avoid anything that contains tyramine, which simply means these are the foods that contain preservatives, fermented, aged, pickled, like cheese and chocolates. And before surgery, they are given high sodium diet to prevent post-op hypotension. For patients with Addison's disease, the main problem is hyponatremia, so decreased sodium. So give them the 4S: sardines, shrimps, salmon, and seafood. And of course, you have to monitor the patient's blood pressure. That's very important. And they need to avoid stress, like going to a dentist. They will have to take their steroids. For Cushing's disease, the main problem here is hypokalemia, decreased potassium. Therefore, you have to give them high potassium foods like fruits and vegetables, and then instruct the client to avoid high sodium foods. Now, for patients with end-stage renal disease, they should be given low potassium foods. And remember, PGBC. So pineapple, grapes, beans, and cucumber are low in potassium. So instruct the patient to avoid foods that are high in potassium like bananas and oranges, because it could potentially worsen the condition. Wilson's disease is an inherited condition that leads to accumulation of copper in the body. Therefore, provide the patient with low copper diet. So avoid beef liver, cocoa, black-eyed peas, and cashew nuts. What are allowed? So eggs and white meat, and rice, as well as oatmeal. For a patient with liver cirrhosis, the diet of the patient should be adequate calorie and protein and low sodium. So instruct the patient to avoid canned products, but they can eat beans, eggs, cheese, fish, and white meat like chicken and turkey. So for patients with on a lacto-ovo-vegetarian diet, instruct them to avoid meat and fish, but they are allowed to eat vegetables, including eggs, and they're allowed to drink milk, including eating dairy products like cheese and butter. So that's the end of our PECHA KUCHA. And that's the end of PECHA KUCHA number 5. And if you want any topic that you are trying to focus on and which you have difficulty identifying which concepts to remember, let me invite you. Let's learn together. Send in your request to my email, mentor.raygapuz@gmail.com, and I'd create a learning tool for you. So this is your mentor, your fact check buddy, saying a functional concept a day keeps your NCLEX RN fears away. See you in the next PECHA KUCHA.